with ferocious anger to this accusation. But there are a lot of strange coincidences there. I don't see any substantial evidentiary basis for this, but there are a lot of coincidences, and a lot of people in the comments are referring to Event 201. Does anyone want to talk about what that is? And I think we can, start getting into some of the clear and very eerie preparations that were being made in the weeks and months leading up to the explosion of novel coronavirus, first in China, allegedly first in China, then in Europe and the US. Do you want to?
Yeah, Anya, do you want to jump in?
Sure, I will jump in and also just give a shout out to so that for people who don't know, to Ben, who while we're doing this is not only participating in the live stream, but he's responsible for throwing up all the graphics and doing all that also. So he's wearing many hats and doing a really nice job. And I saw people praising his reporting in the chat too. So
thank you, Anya.
Thank you. Thank you, Ben. On the topic of 201, Event 201, many people have probably seen reports about this tabletop event held last October at Johns Hopkins University, actually at the Bloomberg Medical School of Johns Hopkins University, named after Michael Bloomberg, the former mayor of New York City and former presidential candidate. And what this simulation was, it was sponsored by the Gates Foundation, the World Bank, one other major institution that's blurbed at the bottom that I can't remember and I don't want to get wrong.
The Johns Hopkins Bloomberg School of Public Health, World Economic Forum, and Bill and Melinda Gates Foundation.
There we go. And maybe if it's possible to bring a scroll through up of the Event 201 page, you can see there, yeah. It was a simulation run by professionals. We don't exactly have an idea of everyone who is at this forum, but they simulated a pandemic, an outbreak, and they actually named it to be a novel coronavirus. And in their simulation, they said that it began as something transmitted between pigs and farmers, spreads through the country of Brazil, then South America. And if you read the page, I don't want to get caught up in doing that now, you can see that it essentially describes the reality, which took place just a few months later in beginning December. Actually, now we're hearing reports that coronavirus was popping up in November in China. And it describes our reality. It describes the economic crisis and the fact that we were greatly underprepared. It predicts 65 million deaths to come as a result of this kind of outbreak. And when people started pointing out the obvious similarities between what happened or what was simulated in Event 201 and then what did happen with the outbreak of coronavirus, the event planners released a statement saying they wanted to be clear they were not predicting this outbreak. The numbers that applied or calculated in that outbreak were not based on any of the science that we have right now regarding coronavirus around the world, or COVID-19, I should say, the novel form of coronavirus we're currently dealing with. And other people are pointing at this to say, well, this shows that it was somehow planned or launched from the United States. That, I think, is getting a little bit carried away. We can get more into the theories about where any of this could have come from. But at this point, most of them are working theories. No one has hard evidence. The one point that I would make about Event 201 is if this simulation took place, which obviously it did, who was involved? Where are the people who studied its results or had a discussion about it? Because we should know, at the very least, we should know what they determined as much as possible, as much as the information that they accumulated or learned through this event. What was the purpose of it, if not for producing information that could benefit the public? That's what it should have been about. if they're not going to share that information with us, then I think you can start to raise other questions. But at the very least, we should say, where are the results of Event 201? What do we know about ourselves based on it?
Well, and
Exactly. Before we follow up, I mean, we have some footage that I just think everyone should be exposed to if they haven't seen it from Event 201 that I just found. Look, epidemiologists knew that a pandemic was coming, so I'm not sitting here alleging that Bill Gates in his like computer cave while he was like doing his, in Seattle or whatever it was.
Windows doesn't even work well enough.
Windows. He probably couldn't muster this up, and he's overseen a lot of failures in the past. So I'm not saying that, but it's just very eerie the way that they predicted exactly what's happening right now in October, and that the results of this simulation are not fully publicly available. So then they produced a sort of a fake news reporter. They made their own kind of news simulation from GNN detailing what the virus will be like, how the public is going to hoard, will die, and it's very similar to what's happening. Maybe we can play like a minute of that right now. Is that possible?
Yeah, I have it set up right here. So, so for those watching, Max and the others aren't going to be able to hear this, but for those watching, I'm about to play a clip here. This clip you can find on YouTube on it's called Center for Health Security, and this is the account that held the Event 201. So this clip, these are publicly available, and you can look into this and do some of your own research. And in fact, I encourage anyone, be citizen journalist, wear the journalist cap, and go check this stuff out and investigate it yourself. But here, I'm going to play some of these really strange clips here, and we can kind of respond to them. So here's one right here.
Start the meeting by viewing this news story that just aired on Global News Network.
You can see here, this is the video from Event 201. And you can see this GNN, which is like this fake CNN-style news network they made. And you can see here that this is
more people. This disease is proving more transmissible than SARS or MERS and about as contagious as influenza. Essentially, the cumulative number of cases is doubling every week. At this rate, we can expect to see 16 times as many cases in a month unless we find a way to interrupt transmission. The virus appears to be spreading rapidly in densely populated and impoverished neighborhoods in some megacities in South America. CAPS is a serious respiratory disease. More than half of the recognized cases have required hospital care, creating a huge strain on healthcare systems. The fatality rate is about 10%. For comparison, CAPS is about as lethal as SARS and 2 to 4 times more lethal than the 1918 influenza pandemic, the worst pandemic on record. Even so, some people only exhibit mild flu-like symptoms, not requiring treatment in a hospital. Alarmingly, those people are able to walk around and spread the virus, not realizing they are doing so. Even worse, international travelers have been arriving at their destinations symptom-free, but within a matter of hours, becoming ill. Travel-related cases have blossomed into outbreaks in a number of locations and have quickly grown faster than health authorities could respond and contain them. In other places, physicians have quickly recognized the symptoms of CAPS and have been able to isolate infected individuals and avoid an outbreak, for now.
Here, I'm going to go to some other
Global public health experts are very concerned about this disease because it appears the virus is readily transmitted through the...
And this is a clip around, for anyone who wants to find this themselves, this is around 44 minutes.
And where those can be deployed, but also CEPI, which was established 3 years ago to accelerate vaccines exactly in development in these settings where a coronavirus is, in fact, one of its indications and first areas of focus. That may not be common knowledge. Likewise, on the financing, there is global financing The criteria identified here would be triggers for the pandemic
World
emergency
Bank.
financing facility, which
Yeah, this is the World
disperse
Bank
a significant
executive.
amount of money into that international pool on the basis of this trajectory of the epidemic. So those are resources that may not be well understood amongst
he talking
the
about
set of
N95
players
masks?
that would.
Yeah. Anyway, so I mean, it's hard to kind of go through all those clips and show live what exactly they were discussing. But I would encourage people. I mean, again, those clips are on YouTube and they're pretty eerie. I mean, some of the things they predicted how there would be a shortage of N95 masks, and this is pretty wild because if you knew there was going to be a shortage of masks, then why wouldn't you have solved that issue? And of course, we can talk about now who the Trump administration is refusing to even pay for the creation of new ventilators, which is insane. I mean, that's essentially murder.